Hello, Mr. Andrews.
Hi. How are you?
I'm well. How are you?
Good.
Good. Well, I'm here today to talk about one of the medications your doctor ordered for you. It's a new medication, so I'm just going to explain a little bit about it.
Mm-hmm.
So your doctor put you on a medication called Lisinopril, and this medicine is for your blood pressure. You have high blood pressure, and high blood pressure is really anything over 140 over 90, okay? And so to control that, to bring it down, we are going to give you this medication, okay? It comes in different doses, but your doctors put you on the 10 milligram one, okay?
Right.
And this medication is to be taken once a day. Now, one thing to keep in mind is the first time that you take this medication, you're going to want to do it in the evening because it tends to make people feel a little bit dizzy. So for that first dose, take it in the evening. Now, after taking it for the first time, you can choose what time you want to take it each day. Morning, evening, but just keep in mind that you want to pick a time where you won't forget, so that you can kind of get in a regular pattern of taking it, because it's very important to take this at the same time each day, okay? Now, if you forget to take a dose, if it's maybe you take it normally in the morning and you forget that morning, it's okay to take it later in the day. However, if you miss a day's dose, then the following day, after the missed day, don't double up, okay? That's not good. So you want to avoid taking 2 doses at the same time to make up for a missed dose. So the missed day, just forget about it. You're going to want to take the dose for that following day, okay? Does that make sense?
Yeah.
Okay. Now, concerning other medications, you're always going to want to check with your doctor or pharmacist even about other medications you might be taking with the Lisinopril, because medicines sometimes can interact, and so you just want to check in with them, okay?
Okay.
Now, your doctor did specify that you shouldn't take salt substitutes, because these salt substitutes don't work well with the Lisinopril, which is your medication. They cause a change in your potassium levels in your body, and so we want to avoid that. So you're going to want to avoid all salt substitutes. And a salt substitute is basically a fake form of salt.
Okay.
Okay. Now, some common side effects here that you'll want to, just be aware of. I'll give you the top 3. One is feelings of lightheadedness or dizziness. And if that does happen, it's completely normal. You'll just want to kind of slow down. So maybe lie down or sit down and just wait a few moments and then sit up or then rise. Just give yourself a little bit of extra time, okay? We don't want you falling or anything. Then there's feelings of sickness, and perhaps nausea, vomiting, even diarrhea. And with this, you'll just want to keep to a more simpler diet, so avoid spicy foods that are really gonna make you feel worse. And then lastly, some people experience a dry cough on this medication, and if this happens, it's not life-threatening, but you just want to talk to your doctor, because there might be a medication that would be better for you. Okay? Now lastly, and this is one of the most important parts, signs of when to call your doctor. So if you experience any difficulty breathing or difficulty swallowing, or if you notice swelling of your face or hands, that's signs of an allergic reaction, and so you're going to want to notify your healthcare provider right away. and also if you notice any skin rash.
Okay.
That is also a sign of when to call your provider.
Okay.
And then lastly, you're just going to want to check in with your doctor regularly to monitor your blood pressure to make sure that your medication is effective for you, and that the doctor can change it if he has to, okay? So making sure you're going in for those regular appointments with him. Do you have any questions for me?
No.
Okay. Now, I understand that we've covered quite a bit of information today, so I just want to make sure that I was clear in the information that I gave you. So if you don't mind, can we review some of the information we talked about?
That's fine.
Okay. So give me a recap of what you know about your new medication, Lisinopril.
Yeah, so it's Lisinopril. It's 10 milligrams, and I take 1 tablet a day, with some water, and I'm taking it for high blood pressure, which is usually like 140/90 is what you consider high blood pressure.
Very good.
Yeah.
And so you mentioned when to take it and how frequently. And what about if you miss a dose?
Yeah, so I need to take it, before the first time I take it, I need to take it before I go to bed because I might feel a little bit lightheaded, but I need to pick morning or evening every other day. If I miss a dose, I don't double up the next day. Like I leave it be. If I just take it later than normal during a day, that's okay too, as long as I take it once a day.
Yes, exactly. And what food or item in your diet will you be avoiding?
I need to avoid like spicy foods because one of the side effects is I could get sick or nausea in my stomach.
Very good. And the other two top side effects?
Yeah, lightheadedness / dizziness. And if I get that way, I need to actually just like sit down or lie down for like a minute. And then the other one was a dry cough that might form from the medicine.
Right. And what would you do in that case?
Probably notify my doctor because they might have something else for me.
Exactly.
Yeah.
Very good. One thing I will mention is the salt substitutes.
Oh, yeah.
You'll want to avoid those because of the
high potassium.
Right.
Okay.
Exactly. Yes. So, very good. And then, can you recall any of the signs of when you should call your doctor?
Swelling of any kind. Let's see here. If I'm having difficulty breathing, if I have difficulty swallowing, and then if I have like any type of skin rashes, call the doctor.
Very good. Yes. Well, we've reviewed this information. I'm going to give you this to take with you just as a reminder of some of the things we've covered.
Okay.
So.
Thank you.
You're welcome.